What up, what up, what up? It's the PAC, man. All things physician associate. And in this video, I want to talk to you guys about the top 3 highest paid surgical specialties, man. And before I even jump into that, let me start by saying happy holidays to all of you guys. I hope you guys are having an amazing, wonderful Christmas pandemic. It's tough, man. You know, it's been it's COVID stuff's crazy, man. I gotta do a video about that soon. But either way, man, let's jump into this. So surgery's tough, man, and what makes surgery extremely challenging to get into is because you can't shadow. Like, there's no hospital really allows you to shadow. Before COVID, it was virtually impossible. Post-COVID, now it's like, forget it. Like, if you were really interested in derm, like, derm is hard to get into, but man, you could, if you call enough dermatologists, someone will let you shadow for free, right? Hell, I'll pay you to let me shadow. Like, let me just be there and get that exposure. Allow me to put you on my resume. Allow me to use you as a reference. You know, when there's a will, there's a way, man. But with surgery, man, the hospital, that's an institution. That's essentially a business, man, a big business, and they look at risk. They have a whole department for that, risk management, and the risk of you being there is not worth it, man. So it's tough, right? So let's leave it there. As far as you can't shadow. 2, the learning curve is extremely difficult in the sense of it's not only like you got to go and learn the ropes, learn, what the office likes and things of that nature. No, surgery is a different beast, man. Like, you need to learn how to surgically scrub in, how to gown, how to glove. You got to learn the instrumentation. You got to orient yourself with the human anatomy. It's no longer like a book. It's not an illustration. It's like a human body. It's very different. Everything's not color coded like blue veins and red arteries. Like, it's all red. And it's tricky, man. It's a lot of learning. The instrumentation, the names are, rare names named after these surgeons who, very hard to pronounce names. It's a lot to learn, man. It's a lot to learn. So it's tough, right? So when a surgeon looks at you, essentially, let's say new graduate who's very passionate about surgery but have no surgical experience, they're looking like, man, it's gonna take too much time, money, and effort to get this person up to speed, man. Is it worth it? Is the question they're asking themselves. And quite frankly, if you were the surgeon, you could respect that type of decision, right? To kind of think, man, I have a practice to run, right? And ultimately, my patients are priority number 1. So is a new graduate really the appropriate thing to do right now? So I understand. But either way, man, this video is about what's the highest paid one, man, because we're going to get it either way, right? Because if you were destined to become a surgical PA, meaning that's what you're truly passionate about, the universe will move aside, baby, so you can get right into position to fulfill your dream. And when you truly are passionate about surgery, you're going to give your absolute best foot forward. It's a constant 110% when you're passionate about what you do, as I am towards family medicine. And when you give that 110%, you are the best thing that ever happened to that patient, right? You are a 100% patient advocate. So either way, man, it's the right, if you're passionate about it, don't let this video or any video discourage you. You do what you got to do, man. This is your, the physician assistant world is your oyster. These are your playing. This is your time, baby. So either way, so as far as pay goes, it's not so much what's the highest paid specialty, and it's more so the who hired you is what's gonna really determine how much you make. Because if I go by specialty, I'd hate for you to be really interested in, let's say, orthopedic surgery, but then I say, hey, heart surgery is the highest paid, and then you just jump into, let's say, heart surgery because you're chasing the dollar. And I'd rather you understand it from the perspective that I'm going to put it in, and then make your decision based off of that. So pretty much what I mean by depends who hires you. You can be hired as a surgical PA by 3 different people, let's say. One, you're hired by the hospital. That means the hospital needs a surgical PA. In the past, they never used to hire physician assistants or physician associates to do that job. They would hire what they call a surgical assistant or a first assistant, which is either a surgical technologist who got additional certification to assist during surgery, or a registered nurse who got additional training to become a first assistant. So they call them RNFA, registered nurse first assistant, or STFA, surgical technologist first assistant role. Right? So that's who they used to get to assist during surgery because they already know everything about surgery. Now they have an additional certification to assist during surgery. But what recently changed is the hospital started thinking, man, if we hire PAs, not only can we train them to, to assist during surgery, but they can also do pre-op and post-op, right? Before surgery and after surgery care. So they can get the patient ready for surgery as far as the surgical consent goes, a 24-hour note, 24 hours before surgery note. They can get all that preoperative preparation, blood work, what have you, interpret lab results, make sure everything, all I's are dotted, T's are crossed. And then post-operatively, they could pain management, wound care management, all this stuff that essentially a surgical tech or a nurse could do if trained, but are not trained to do so and are not licensed to do so, at least not the surgical tech. And yet the PA under the same, let's say, pay scale can do both. So, but as far as that pay scale goes, hospitals are very organized when it comes to pay. And what I mean by organized is that there's not a lot of negotiation per se. They follow pay codes. So let's say a surgical PA, they open up the pay code. It's a bracket of how much they can afford to pay you, and then that narrows depending on how much you qualify for that position. So if, for instance, if you have 0 experience, then that's how much we could pay you, period, take it or leave it. If you have some experience, that opens up a little bit more, and then depending on how long you've been a PA and all these extra factors, any additional certifications you may have, if all that kind of starts to tie into how much they can afford to pay you, and then your negotiation is within that window, right? So that's a hospital hiring you. The second option is if a surgical group hires you. So a surgical group is a group that approaches the hospital and says, hey man, look, I know it's hard to find PAs that know how to assist during surgery. Why don't you hire us as a contracting company or a staffing company, and we will staff your OR at all times. The beauty of it is during your down times, let's say you close the OR for, let's say the operating room is closed for COVID, pandemic, country closes again. Or let's say it's the holidays and not that many surgeons are booking surgery. Okay, then if you're a full-time employee, the hospital still owes you something, right? You either gotta bring them in and make them do, grunt work just to keep them busy, or you gotta pay them to be off or use their pay time off, or something's got to give because they're employees. But if they're contracted by a staffing company, then you could just say, hey, your services aren't needed this month. And so by hiring a contract company, it's you kind of pay as you go. So if you need a surgical PA today, I will staff one. But if you don't worry about it. They don't get paid if they're not needed. So hospitals like that, and those and they'll pay a little bit more for that, knowing that they don't need to pay all the time. They're only paying as they need them. Therefore, those particular staffing groups could afford to pay you a little bit better than the hospital could pay you directly, because one, they're not offering you any benefits. I mean, they could, but they usually don't. And two, they're not guaranteeing you any work. So the only way that they could really attract you to want to work for them is they pay very well. They pay much better than the hospital. If they paid equivalent to the hospital, then it really is no incentive for you to jump ship to a staffing company as opposed to the hospital, because you're paying the same minus the benefits. What's the point? So they pay better. The third option is if a surgeon hires you directly. And what I mean by a surgeon hiring you directly means that this surgeon wants you to run the clinic for them while they go do surgery. So basically, you line them up and they knock them out. So basically, let's say the surgeon's going to be in the operating room Monday, Wednesday, Fridays, and then they're going to be in the clinic on Tuesdays and Thursdays. So on Monday, Wednesday, Fridays, you're in the clinic running the show by yourself, seeing new patients coming in or patients post-operatively that are coming back for their 2-week follow-up, and you're checking them out, making sure the wound is healing well. And the new patients, you're determining, reinterpreting results and saying, yep, you need surgery, or nope, we could treat this another way. And if they need surgery, you book them for surgery, and the surgeon will knock them out on those Monday, Wednesday, Fridays. And on Tuesday, Thursdays, then you double book the office. Instead of 50 patients, there's 100 patients, because the surgeon's going to be there to help see patients that day, right? So you guys are kind of like a well-oiled machine, right? That is one of the most beautiful symbiotic relationships I believe in the physician assistant world. When a surgeon is off doing their thing and the PA is running the clinic, I just feel like, man, what a well-oiled machine. It just works nice. And but that surgeon, now you're making that surgeon essentially money, lots of money, partly because you're scheduling surgeries for him, right? You got a patient comes in with a broken bone that's not displaced. You could just put a cast on it yourself and have them come back in 2 weeks, check it out. But if it's displaced or needs surgery, now you're scheduling the surgery. And so that surgeon is, one, they already got money reimbursed from the insurance for even having that patient show up to the clinic to see you, the PA. And now they're gonna get money off of the surgery by doing the surgery, and then money for having the patient follow up 2 weeks later. So there's a lot of money being made, so that surgeon can afford to pay you accordingly, right? So in the order of lowest to highest paid, the hospital pays the least but has the best benefits. A surgical staffing group pays a little better, but usually you sacrifice the benefits. And a private surgeon really is the best bet as far as work-life balance, because in the hospital or in a staffing group, you can easily work weekends. Usually a surgeon doesn't really, if you're working for a surgeon and you're running the clinic, you're not gonna find yourself in the OR on a Saturday, Sunday like that. So it has probably the best work-life balance, and the pay is the most variable because there is no bracket. It's whatever you guys agree upon, whatever you think you're worth. So, and you can always start at a baseline number, let's say 100,000 a year. Let's reassess in 3 months, see if I'm not worth more then. And I get that I'm not producing any money for you in the beginning because I'm learning. 90 days from now, tell me if I'm not making you money. So it's beautiful because you can't have those conversations with a human resource department in a hospital. They're like, yeah, no, that's a negative. So additionally, I mentioned for working directly for a surgeon that you're kind of running the clinic. There are some surgeons who prefer to bring you to the OR because they trained you specifically. So they say, hey, you know what? We'll see patients together on Tuesday, Thursdays, but Monday, Wednesday, Fridays, meet me in the hospital and let's just do surgeries instead. And so that's all dependent on the surgeon. Some PAs love that, to get a little bit of both, get your hands dirty in the OR and then see some patients, one day on, one day off kind of thing. And they like that. So, and you may like that. So it really all depends on what you're looking for, man. So I think that's pretty much, I'm pulling up to work now. I think that's pretty much all I got on surgical PA. But yo, if you guys have any questions though, any questions whatsoever, any ideas for a video, man, I'd love to do them. I enjoy these a lot. Sometimes I can't think of anything to talk about. And if you guys have any videos you want to see, feel free to leave them in the comment section below. And I promise you, I'll either respond back to your message if it's an easy answer, and if it's a video worthy question, then rest assured a video will be coming up, man. But either way, man, love you guys. Stay safe out there. Wear your mask. Wash your hands. All right, see you guys. Love you.